Hi everybody. Today's topic is what the hell is home health? As a caregiver, you probably hear all these terms from doctors and nurses that talk about home health and ADLs and IADLs and UTIs and all this medical terminology. So a caregiver came up to me the other day and said, Pamela, all these acronyms, all these terms, what the hell is home health and why should I care about it? So that's what we're going to talk about today. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, a lot of hope, help, support for caregivers and aging adults. Entire online courses. My podcast, The Caring Generation, my blog, videos, access to a caregiver survey, information about my caregiver support group on Facebook, which is called The Caregiving Trap. I invite you to join. So let's talk about caregiving. Are you a caregiver involved in taking parents to doctor appointments? Or maybe mom or dad have been in the hospital and then they went to a nursing home and they said, oh, you need home health. And your parents are like, I don't want home health. I don't want anybody coming into the home. No, not going to happen, right? Well, I want to talk about why considering home health is a good idea and why asking and learning about what it is can be very positive. So a lot of times somebody's going to say, oh, your parent needs home health, and mom or dad are going to say, no, I don't want anybody coming into the house. Well, really the question that you should be asking is, what is home health? Why should we consider it? And if we don't do this, what's going to happen? Because the what's going to happen is the motivator here, right? If your parent really needs to come home from a nursing home or a hospital and wants to get better and regain their physical strength, home health can be the way to do it. And many times, at that point at least, insurance will pay for it. So why not take advantage of something that can improve your parent's life and decrease the time that you as a caregiver have to spend time doing things for your parents for, right? So let's talk about the categories that this comes in, right? So it's Medicare, Medicaid, VA services, and long-term care. Again, more words that caregivers are like, what the hell is that? Well, I'm here to explain it. So a simple explanation about home health basically means any services provided in a home wherever your parents live. Now, it can be anything from skilled care that I will define in a moment to non-medical care, to social services, to other programs that help older people who live in their homes or even in a care community, because home really is where you live, right? It doesn't matter if you live in a house, in a independent living community, assisted living, nursing home, there's still the idea of home health. Now, the goal of home health is that it's usually a less expensive option. So if your parents in a nursing home, they can go home and receive some physical therapy services and they don't have to stay physically in the nursing home where they probably don't want to be anyway, right? So go home and get the same level of therapy exercises. Now the problem, as I mentioned before, is that the benefits or the consequences, nobody ever talks about them. They're just like, do you want home health? And the caregiver, the parents say, no, nobody coming into the home, we're good. Again, the question you want to ask is, why should we do this? What are the consequences if we do not? So let's start with Medicare. Medicare pays for skilled care. Nurses, physical therapy, occupational therapy, speech therapy, home care aides who come into the home to do things like help with bathing and dressing and things like that, and social workers for people who live in their home. Now there's a requirement that you must be homebound. So you can't be like, going out and doing all these things and have people coming to your home to help you, because the idea is that you can't do all these things and you need help in your home. So you have to be homebound. Doctor has to write a prescription. It has to go to an agency who receives approval from Medicare. Now, as I mentioned before, it's typically ordered after hospitalization or nursing home stay with the goal of helping your parent regain their strength and get better. Now, the second part of this is Medicaid, which works with Medicare, but Medicaid is for low-income elderly, low-income people who have certain conditions. Now, Medicaid has a benefit called home health and home and community-based services. Could be called by a different name. Every state has their own Medicaid program, so they get to determine what they're going to call it. But that type of home health, so Medicaid home health, can be combined with Medicare. And so again, it relates to care in the home. Medicaid can also include case management and other types of services. But again, the idea is helping your parents become more physically able to care for themselves. Now, the VA, Veterans Administration, they also have their own home health care program. Skilled home health care, a lot like Medicare, and then they have home-based primary care programs where doctors may show up, case managers may show up, they may offer mental health services. So working with the VA, if you ask about these, if they offer, say, well, tell me all about that program, which is what you should say anytime anybody mentions one of these. Tell me all about that program. How does it work? What does it help me do? What's the benefit? How long does insurance pay? All of that is very important. Now, beyond Medicare and Medicaid and the VA, there's a broader level of service just called home care and long-term care. Now, these can be insurance-based, but they can also be private pay where you're writing a check, your parents are writing a check. But really, home care is for anybody. So children, the elderly, disabled, veterans, anybody who needs help in the home after a health incident or because they have health problems. So when you think about home health, think about the benefits, especially if you're the caregiver, right? And again, there's home care, home health paid by insurance, and then by private payment. So your parents are writing the check. If you're a caregiver and you can't show up every day and your parents are struggling and they need help, then it's time to consider home health from a paid point of view. Can these caregivers relieve you of the things that you do? Can they help your parents bathe and go get groceries and do all these other things that would be so helpful for you so that your time with your parents is quality time? You're not this errand runner or this chore worker or the person who has to do all these things and you're so exhausted and you just don't know how you are going to keep going. So what the hell is home health? Home health can be a huge support, a huge help for the elderly and the caregivers when you learn what it is, learn the benefits, learn how it's paid for, and actually use it. I'm Pamela D. Wilson. Thanks for being here. Please share this video. Follow me on YouTube so that other people can find hope, help, and support in the areas of caregiving, aging, caregiving, relationships, and everything in between. Have a fabulous day. Come back. Check out another video.